Assalamualaikum doctors. In this video, I am discussing a history SLE, systemic lupus erythromatosus. So how can it come? The chief complaints are child with knee pain for 4 months, child with headache, child with back pain. So back pain, headache, knee pain, like that come. So first chief complaint analysis, that if limping, is it unilateral or bilateral, onset, course and durations, anything make it better, anything make it worse. Then what about the painful joint? Analysis of the joint pain, that is Socrates, we know. What about the site of the pain? Onset, character, radiation, associated symptoms, timing, course, exacerbating or relieving factor, severity scale 1 to 10, and other joints, previous similar attack, look, feel, move, these are. So these are site, onset, character, radiation, associated symptoms, timing, course, exacerbating and relieving factor, severity scale from 1 to 10, other joint involved, previous similar attack, and look, feel, movement. Now, what did you do for this? What medicine he has taken? Any test, any imaging done? General FWASL, that is fever, unplanned weight loss, change in appetite, decreased activity, and is the fatigue. Then sleep disturbance, pain at night, morning stiffness. Other concerns are long-term medical condition or any chronic illness. If yes, all past history now. Then systemic review. One by one, MSK, skin rash, malar rash we will find in the face. So this is very important. Look the picture, that is like that. Skin spots, pigmentation, skin lumps, joint pain, joint swelling, bone pain, hair, nail changes. Urinary change in pee, amount, color, frothy, frequency, pain, swelling in the private part. Anyone measure the blood pressure. GIT about the tummy pain, tummy distension, recent change in poo and mouth ulcers. CNS plus neuropsychiatric, that is headache, morning vomiting, facial asymmetry, curving of the back, unusual walk, unusual movement, mood change or unusual behavior, eye redness, eye deviations, any concern about vision, hearing and speech. Then about the hematology is bleeding, bruising, recurrent bugs, all details, especially the sickle cell disease or hemophilia. Chest about the difficult breathing, recurrent bugs, chest pain. Endocrine, diabetes, mellitus, blood glucose, thyroid, hot or cold intolerance, Addison plus other autoimmune. CVS are awareness of heartbeat, rat racing, intolerance to exercise, easy fatigability and blood pressure. Then go the past history, follow trauma, travel, camping for Lyme disease. So Lyme disease, one of the DD, remember. Medicine, steroid, drugs induced lupus. Tests done, imaging done, recent viral infections, acute myositis, transient synovitis, admissions, and team. Parental history, any clinical medications of medicines taken during pregnancy, screening for DDH, developmental dysplasia of the hip, any bony deformity that needed treatment. Then we are going for the puberty. Puberty is that if around its age, did Alia started her monthly period, did Ali show features to be a young man or asked directly started puberty? Vaccination up to date, any extra vaccinations? Allergy to food, medicines, nutrition or if any change in weight, growth chart, especially if known case on steroid treatment, development, loss of skills, difficulty in walking, writing or wearing clothes, family history of same conditions, family history of long-term medical conditions, psoriasis, consanguinity, family dynamics, social or home modifications, school types, absence, performance, bullying, psychological impact, that is how does this condition affect the family. So what are the DD we can keep for SLE? Systemic lupus erythematosus, juvenile idiopathic arthritis, the systemic onset of GIA, dermatomyositis, psoriatic arthritis and Lyme disease. I am telling the diagnostic criteria of features of SLE. Easy to remember, SOAP Brain MD. So SOAP Brain MD is that we will find diagnosis 4 out of 11 features. Okay, for 11 among them 4 features. First of all, serositis, pleuritis, pericarditis. So we find chest pain in the history. Oral ulcer we find arthritis, that is limping, photosensitivity. When go the sun, there is rash on the face. Blood disorder, the child is anemic, so racing heartbeat. Renal involvement, we find frothy urine, proteinuria present. Na plus neurologic, that is we will find recently changed the behavior or psychic behavior. Immunologic, SM, anti-DS DNA, malar rash and discoid rash. There are some classification of SLE, that is require more than 4 criteria, that is some antibodies, clinical criteria and the immunological criteria. Clinical criteria are acute cutaneous lupus, chronic cutaneous lupus, oral or nasal ulcers, non-scarring alopecia, arthritis, serositis, renal, neurologic, hemolytic anemia, leukopenia, thrombocytopenia less than 1 lakh per millimeter cube. And immunologic criteria are ANA, anti-DNA, anti-SM, anti-phospholipid antibody, low complement C3, C4 and CH50. Then direct COMS test do not count in the presence of hemolytic anemia. So this is about SLE history and the features. Thank you.